Good morning, dear guests. I'm Hilal Akgul. I'm a medical doctor working in Istanbul, in Turkey. I'm a psychiatrist in a third level health institution. Thank you for invitation for a lecture about an eating disorder called Pika. We will discuss about this topic in 25 minutes you given to me. That's an eating disorder. That's why I find it meaningful to talk about this disease at a congress about food technology and nutrition. And I'm starting my presentation hoping it will be beneficial for all of us. Back, please. Back, please. No, not next. Back. Previous. Okay, that's fine. What is the Pika? I don't know whether you have heard or not about that before, but it is a very interesting psychiatric illness. There are a lot of interesting psychiatric situations, in fact, in movies like, dissociative personality disorders. People suffered from this illness, show up 3 or more different personalities, which main personality doesn't recognize them and have 3 different lives like this. Pika is one of the interesting psychiatric illness too. It is an eating disorder. Next, please. Pick a word. Next slide, please. Pick a word originates from a Latin word, comes from a bird called magpie in English. These birds are members of the Corvidae family and they tend to eat a lot of non-nutrient things. Like this bird, people diagnosed with Pika also exhibit behavior of consuming non-nutritional foods for at least 1 month. Between parentheses, it's written here DSM-5. We make this eating disorder diagnosed with a diagnostic statistical manual of mental disorders, 5th edition. I will say DSM-5 from now on. Next slide, please. Pika formerly in DSM-4 was under a section of disorders of childhood and adolescence onset disorders, but now in DSM-5 has been evaluated under the umbrella of feeding and eating disorders. The other popular eating disorders like anorexia nervosa or bulimia nervosa. Anorexia is known as body image and body weight perception disorder. The person has energy intake restriction and afraid of gaining weight. And bulimia has binge eating periods and self-induced vomiting and some actions like taking laxative pills. They are widely known. Unlike these illnesses, Pika is uncommon and can be unnoticed in the psychiatric or medical examination or inspection because they have normal body mass index, because they are consuming non-nutritious food. And patient usually tends to hide it. It onsets in childhood, and if adults have this disorder, usually have comorbid intellectual disabilities. But there are cases, like the case I will mention about later, some of them have not additional mental illness. Next slide, please. Now let's check the some 5 criteria for Pika. 1, persistent eating of non-nutritive non-food substances for a period at least 1 month. And 2, eating of non-nutritive non-food substances is inappropriate to the psychological developmental level of the individual. And 3, eating behavior is not part of a culturally supported or socially normative practice. And if it occurs with another mental disorder or during a medical condition, it is severe enough to warrant independent clinical attention. Next slide, please. Well, what do they eat? They can eat these materials you see: clay, soap, soil, paper coins, ash, ice, paint crumbs, stone, etc. But there is one point that I want to draw attention. Materials like fishes, like coins, glass, or sharp objects can be eaten by patients with comorbid psychiatric conditions like schizophrenia or mental disabilities. Next slide, please. When we look at epidemiology, studies have been made in Germany and in Switzerland in 2018. And it was found that in children aged 7 to 14 years, the prevalence was approximately 3 or 4%. And it was observed more often in boys than in girls. May begin in childhood or in adulthood. Comorbid diagnoses like autism spectrum disorder and mental impairment are more common in children and adolescents. And in individuals with mental retardation, prevalence of Pika ranges from 5.7% to 25.8%. It often lasts a few months and then subsides and indicates incompatibility with the psychological developmental level of the person. We know this information is. Next, please. One look at its etiology. Its etiology is poorly understood and is likely multifactorial. Psychosocial and biochemical factors come to the fore. Strong association between Pika and low socioeconomic status, neglect, abuse, inadequate mother-child interaction is shown. And it can have comorbid situations either, such as underlying some illnesses, schizophrenia, as I said, pregnancy, obsessive-compulsive disorder, autism spectrum disorder, non-suicidal self-harm disorder, or strongly iron deficiency anemia, and feeling of satiety in a dieting person, and factitious disorder. In factitious disorder, this one, maybe you heard that before, the person can consume non-food items to create symptoms of a serious disease. Next slide, please. There is also a case report of Pika onset after organic brain injury and another case with comorbid multiple sclerosis. In another case report in the literature, a decrease in the volume of the corpus callosum and enlargement in the sylvian fissure and brain sulcus asymmetry were observed in cranial magnetic resonance imaging. So, in situations with anatomical structure defect, Pika or Pika-like symptoms can occur. Next slide, please. When I look at complications, Pika may be overlooked and the person may continue to live asymptomatically, or it may lead to serious complications. Lead poisoning as a result of ingestion of lead containing paint residues, and colon ischemia or intestinal obstructions, and perforations due to hair, gravel, matchstick, or stone ingestion. And parasitosis due to soil and feces consumption, and anemia and zinc deficiencies due to clay ingestion. Also, consumption of large amount of starch can cause secondary iron deficiency anemia. Because of that, that is an important disease. Next, please. Although there is no laboratory test to make a definitive diagnosis, serum lead level should be checked for the possibility of poisoning in suspected Pika cases. In addition, serum zinc, iron, and hemoglobin levels should be seen for replacement therapy when deficiency is detected. For example, in the literature, there's a case of eating a large amount of lemon and at the same time has iron deficiency in her blood. She was with history of Roxanne gastric bypass surgery and has heavy menstrual cycles. And she was found to have a severe microcystic anemia with a hemoglobin count of 7. And I want to mention another case with sponge eating, has comorbid iron deficiency and celiac disease. In these cases, symptoms improved when iron replacement therapy. Because of this, for not to make diagnosis just for the treatment, we have to pay attention to laboratory tests. Before the case, the last thing I want to talk about is a treatment. Taking medical and psychiatric history carefully is so important. After that, exposure to toxic material should be questioned. Neglect or abuse should be investigated for child and infant cases. Also, anamnesis could be useful to determine the psychiatric developmental level of the person. Well, what do we do for treatment? In child cases, only safe materials should be available on the playground. Family training by using psychosocial, environmental, and behavioral interventions aim to eliminate childhood stressors and support neuropsychological development of the child. And in adult cases who are diagnosed with comorbid mental illness, should be in close observation and follow-up by caregivers. And one treatment focus of Pika on those with intellectual and developmental disabilities who engage in higher rate of Pika behavior is ABT, we call Applied Behavior Therapy. Is one of the most effective therapies, and it is widely and successfully applied to those with intellectual disabilities, including those with autism and other disorders. ABT teaches new behaviors by rewarding and reinforcing positive behaviors and eliminating unwanted behaviors. Next slide, please. But in adults without additional mental illness, objective of eating behavior should be questioned. What does this behavior serve? drawing attention, trying to communicate, avoiding routine work, or feeling satisfied. We discussed this with the patient, and behavioral planning should be made for determinable reasons and for effective communication. Cognitive behavioral therapy, family therapy, and interpersonal psychotherapy are commonly used to treat eating disorders like this. And there are reports in the literature that next to therapy, psychotherapy, selective serotonin reuptake inhibitor usage have yielded successful results. The next slide, please. It has been reported that oral stimulation such as chewing gum or popcorn may also be beneficial for symptomatic treatment. It has been suggested that patient who feels entering the Pika behavior should have a Pika box that can facilitate access to these oral stimulant materials. Now I want to go on with the case. You are seeing the images that belongs to her. It's about 29 years old woman comes with obstruction symptoms to our emergency service. The upper one, you are seeing the obstruction material in endoscopy, and the middle image there is air fluid levels. That means in medicine there is an obstruction in gastrointestinal system, and the third one, you are seeing the computer tomography images, and there is a wall thickening there. I will mention about that later. Next, please. A 29-year-old female patient applied to emergency service with the complaint of abdominal pain and constipation ongoing for 2 days. In the laboratory test, her blood leukocyte value was detected at 22,000, and widespread abdominal tenderness was found in the abdominal examination. After applying laxative treatment, they sent her to her home, but after 1 day, she admitted emergency service with the same complaint again. Then X-ray and CT planned. Air fluid levels were seen in X-ray, and wall thickening was detected in area corresponding to the rectosigmoid corner in lower abdominal computer tomography. She was born in Zonguldak, Ereğli, which is a northern town in Turkey. She was the first of 4 siblings and graduated from high school. She completed high school with distant learning and was preparing for the university entrance exam. Patient who previously worked as barista, secretary, or cashier was unemployed at the time of admittance, and she was married for 11 years and has 4-year-old son. Now, the patient complaint was eating 4 or 5 packs of matchsticks in a day for 3 or 4 years. At night, when her husband and son were asleep, while she was watching TV, she threw the flammable ends of the matches and bit rest of them in small pieces, soaked it up, and kept turning it around in her mouth before swallowing. She says that she felt an incredibly strong desire to do this behavior and felt happy at every stage of it, and she was not disgusted. And she did not describe a feeling of anxiety before or after swallowing it. She stated that she hidden this behavior from everyone until now, thinking that it was an act that should be hidden and be ashamed of. Because of what she was doing, she was angry with herself, and she did not eat during the day because matchstick parts in her mouth prevented communication. And also she was worried that people would notice. She had inside and done research about Pika. She knew that the situation might be caused by anemia. When we check her psychiatric history, she did not have a history of regular psychiatric treatment. Once she started fluoxetine treatment for a 3-month period when she was a secretary for a psychiatrist, but she dropped out. In her psychiatric examination, her mood was depressed and dysphoric, and her affect was ashamed and tearful. Delusions, obsessions, or ruminations were not encountered in the content of her thought, and no illusions or hallucinations were detected as perception defects. And she did not describe any other eating disorders, symptoms such as binge eating, self-induced vomiting, or excessive dietary or food intake restriction. In content of her thoughts, her son includes her son who could not be able to speak yet, her marriage problems, feeling of insecurity, dislike of her own body, and concerns about the future. The patient didn't describe any alcohol or drug abuse, but has been smoking for 10 years. And she did not describe having a manic or hypomanic episode before that these are symptoms of bipolar disorder. And she stated that never attempted suicide before, and there was still no active suicidal ideation. Next, please. When we check her family history, she had three younger siblings and her parents were alive. There were no history of diagnosed psychiatric illness in her siblings or parents, and there were no disease or neurodevelopmental disorder known in her childhood. She said that she was a successful child at school, got along well with her friends and cousins, but in elementary school it was learned that sometimes she ate shaped pencil residues, and according to his mother, in her childhood she tore fabric of armchairs and ate its sponges. After moving from Ereğli to Istanbul at age of 11, there are hard times for her. Because of decreased financial income, they could not pay their house rent. They sometimes skipped meals because they could not find food and asked their neighbors for basic food materials such as bread, tea, and cheese. After a while, her mother also started working, and she stated that she was successful in her lessons, but her mother did not allow her to attend high school because her mother also started working. She did housework, made meals, babysit her youngest brother, and helped her siblings with their homework. Even after all these works, she said that my mother didn't approve me what I did, and didn't approve what I did, and behaved oppressively, accusatory, and untrustworthy towards me. I remember, she said. She described two instances of sexual abuse at age of 15 and 9, and she had emotional involvement while telling her memory that she remembered that her trauma in pieces. Her judgment was adequate, and her insight into her illness was intact, and there wasn't any cognitive deficiency. Next, please. When we check her laboratory tests, iron deficiency anemia was detected really with 7.9 hemoglobin levels and low mean corpuscular volume, and vitamin B12 levels were low too. A medical treatment was arranged, rectosigmoidoscopy repeated, and obstruction material was seen after 4 days with edema released, and you see that matchstick parts. With her general condition getting better, the patient had gas stool purge and she was discharged with recommendations. Fluoxetine 20 mg a day was started for the present depression during the hospitalization, and follow-up proceedings started from the psychiatric outpatient clinic. But as you can guess, she didn't show up and dropped out from the treatment again. Let me sum up the case in a few sentences. First, the patient ate sponges on the seat side in childhood and shaving residue of the pencils during primary school period. Remarkable thing is that symptoms started in childhood. And second, poverty and stressors in processing of living in a new place and getting used to it after age of 11 may have precipitated her illness and facilitated the emergence of her behavior. Pika is more common in those with low socioeconomic levels, since decrease of the consumption of foods such as meat, fish, egg, milk, yogurt, and cheese due to their insufficient financial situation. Third, iron deficiency. Iron deficiency anemia was detected during her hospitalization too. As we know, Pika is strongly associated with iron deficiency, and meta-analysis state that Pika behavior is significantly associated with lower concentration of hemoglobin levels and across all populations. And it's also known unusual eating and chewing behavior causes reduction in iron supplementation as a result. And four, Pika is often comorbid with other mental disorders, and many may be seen in autism spectrum disorder or schizophrenia or non-suicidal self-injury. But the patient had no definitive additional psychiatric or other chronic systematic disease. Similarly, there are case reports without a history of comorbid disease in the literature. And this is my last slide. Next, please. Sexual abuse is an experience that can develop psychiatric disorders like dissociative disorders or personality disorders, and it causes serious damage on psychology when it happens in childhood. Just as it was mentioned in our case, a 20-year-old female who swallowed hard objects was reported to having suffered from sexual abuse in childhood as well. And further research is needed on whether it is one of the leading causes of Pika behavior. If I sum up all my presentation, improvement in the socioeconomical status of people, as well as a rise in the educational level, and establishing healthy connections between members of the family, especially with caregivers like mother, will help an early recognition, treatment, or prevention of this issue. Hence, it's thought that Pika ratio will decrease if the society is educated on this specific disease. Next, please. Merci de votre attention. Thank you very much for your attention. That's the last slide of my presentation.